We are coming towards the end of Regional Committee 65, a very successful regional committee held here in Khartoum, in Sudan. And with us now is the dynamo behind all this, Dr. Naeema Al-Gasseer, the WHO representative in Sudan. May I congratulate you?
Thank you, Dr. Ibrahim. It's very pleased to have you here in Khartoum with us.
It's been a very fruitful one, a very active one, the first for the regional director, but you orchestrated it very well, Dr. Naeema.
I have to say it has been a whole team between the government of Sudan, led by Federal Ministry of Health, the civil society, our dear nursing organization, medical organization, and pharmaceutical organization students who have really volunteered.
I saw them out there. They were really lovely.
Yes, and also our WHO country team, beside the whole WHO team supporting us.
But I must say it was done in the typical Dr. Naeema form. There were so many activities. The walk the talk was a very exciting one just prior to the official RC.
The walk the talk was our vision because this year is 70th anniversary of World Health Organization, and we were trying to bring the message on healthy behaviors. The timing was good because we had all the dignitaries and the attention of all the society from all the walks of the lives to the assembly.
And another very important thing that came out, we all said health for all. In Sudan here it became health for all, by all. Even the Director General took that caption and said it in Arabic as well. It was wonderful to hear. And Sudan was a pioneer in health in all policies.
Yes.
How did that come about?
First of all, health for all, by all, الصحة للجميع بالجميع, is a real movement of not only focusing on individual on a political commitment, but also with individuals and in collaboration. Where health in all policies coming for Sudan, this is actually stemmed from primary healthcare Al-Ma'ata, which we are also celebrating 40th anniversary. And many people need to know also is driven from World Health Organization Constitution 70 years ago.
Okay.
Because health definition is broader than sickness.
Yes.
And that's the message. And if we want to avoid sickness, we need to know how are we going to handle it. That is healthy environment, healthy air breathing, healthy roads, safety of the homes, healthy behaviors in our food.
But how did you manage to ensure that all the different ministries really come in as partners?
Yes, I have to say the health in all policies started with the mentality of Sudanese. If anyone knows Sudan, Sudan was one of the leaders in terms of really implementing the Al-Ma'ata principles of bringing and engaging communities and healthy behaviors. It moved and then it dwindled into curative and hospital side, and it came back in 2014 on how to move for the universal health coverage. Within that, the realization that you cannot, for example, the burden of the health systems health services was from road traffic accidents. And Ministry of Health does not have to do anything with road traffic accidents. So you need to bring Ministry of Interior, you need to bring the Ministry of Infrastructure, you need to bring the legislators, and that's the way it started. There are a very group dynamics of the Ministry of Health core leaders who started that. I would say that in the last 4 years, what we managed to do is to open it up and expand it. Not to have only a critical few, but to bring everybody on board. The good thing about it is really the walk the talk that we talked about, is that bringing and having a dialogue, a continuous dialogue, not only with the other ministries, but also at the senior level, parliamentarian, civil society. The dialogue was sometimes very intense and at the same time understanding. For example, the last 4 years or less, we succeeded to have industry with iodized salt.
Okay.
This was a multi-sector, multi-disciplines, private sector engagement, civil society, researchers, academicians.
And now it's all over? I mean, the salt
it's done.
Now it's done.
50% now. It's in the industry, and we were part of it as WHO and other partners also to bring it happen. You have Ministry of Justice. You have the Parliament who is actually reviewing the laws.
So the floor is really ready for more of health for all in all policies.
Yes.
Dr. Naeema, I would love to go on talking, but we have very short time.
I just
so
want
I want
to
you to
bring
give a
one
message.
thing,
and
my key message is here. Political commitment by the president of the country has made a big difference. So it's not theory, it's walking the talk, signing by all the sectors and trying to implement. And already the roadmap has not only been written, but being implemented. Let's walk the talk together for making us all healthier and each one of us responsible for our own health.
Dr. Naeema, congratulations.
Thank you very much.
Health for all, by all.
Thank you. Health for all, by all. Thank you.